Obviously, okay, now, you have a unique position sort of interacting with a lot of experts, right, in this melanoma field. How do you recommend a patient to find the expert? And I mean, the question is, one of the challenging thing is, uh, how do you get the care, the access, and more importantly, how do you know the patient can trust that physician, they're competent enough to take care of them?
Sure. Well, I certainly don't want to come across as the expert on how to choose a physician, but I think we can share some information on how people can get started. Very simply, there are several resources available online. When you're talking about melanoma, right, and let's assume we're talking about someone that they have not been yet diagnosed, right, because they're not yet in the system or the pipeline, let's say. If someone is afraid that they have something, they should certainly go to a dermatologist first, right? We always say a board certified dermatologist. I think I would look to see if they have experience with skin cancer. Dermatology, spans across a lot of different areas, everything from acne to rosacea to aesthetics and things like that. So I think we look for someone who specializes in skin cancer, whether it's that they're a Mohs surgeon or they're somehow affiliated with skin cancer in a bigger way, or they've written articles related to skin cancer. But I think the number one thing is to first find a dermatologist. General practitioners are a fantastic piece of the puzzle, but we know that it's very difficult for them to fully understand what's going on with skin cancer when they're also dealing with a lot of other things. So finding a board certified dermatologist is number one. And you can do that either by going to our website. We have something called our physician finder, where you can go in and type in your zip code, and it'll give you people that are in the area, physicians, dermatologists that are in the area. Those are doctors that are affiliated with the foundation in some way. There are also other available links. The American Academy of Dermatology has a very robust list of dermatologists. Again, you can type in your zip code and find people that way. We know that some people are lucky enough to live in areas where there are more dermatologists. So sometimes the New York, the Los Angeles, the Miamis, Chicago's of the world, and some people might have to drive a little bit further to find a dermatologist. But I think it's most important that they get to a dermatologist as opposed to maybe the doctor that just happens to be down the street.
But what about the people who have already been diagnosed
Yep.
with melanoma?
Yep. Well, so the people that have been diagnosed with melanoma, I think the most important thing is for them to, first of all, follow their doctor's lead, right? So
Sure.
understanding if the dermatologist had already diagnosed them with melanoma, there's so many different things that can happen from that point, right? Is it something surgical that happens right there with the dermatologist, depending on how deep the melanoma is? Or is it something where the person's going to have to go a little bit further and maybe go to a surgical oncologist or an oncologist and deal with it another way and start getting into other types of procedures? So it's difficult for me to say exactly what they need to do because there are so many different routes that someone could take. But the number one thing is to take action, I think. And it's really, if your dermatologist knows that you need to go one step further, to make sure that you follow that advice. There are certain cancer centers in the United States that are very, very well known, whether it's Sloan Kettering or MD Anderson, the Mayo Clinic, Moffitt Center down in Florida. So those are the really big ones. There are certainly very capable medical facilities regionally around in so many local areas. So again, I can't say exactly what they should look for in a doctor other than making sure that they follow the process and do what they're told to do by the initial dermatologist that gives them the diagnosis. And I also would recommend that people get second opinions on things. Right. I
Yeah,
think
I agree, and
super
especially with
important to make sure that you're shopping around and you're doing the right thing for yourself and self-advocating. Not that there aren't great doctors everywhere, but I think always understanding what your options are and understanding what certain treatment procedures should be is really important for patients.
No, I think you summarized it very well. I mean, I think obviously listen to your dermatologist if you've been diagnosed, right? And then act expediently, don't wait. And a lot of times, luckily, most melanoma can be easily excised, but there are times when they have advanced stage melanomas, you need this kind of a coordination between these different